All right, let's jump right into this. Welcome to today's Explainer, where we're tackling a situation that is just incredibly stressful, both physically and financially. We're talking about getting hurt on the job. Over the next few minutes, we're going to break down exactly what you should do when you experience a workplace injury, the absolute critical first steps you need to take, and why that old school mentality of just, pushing through the pain is literally never the right answer for your body or your career.
So, be honest with me for a second. Are you currently pushing through pain at work, just crossing your fingers and hoping it'll magically fade away? I really want to speak directly to that frustration you might be feeling right now. Look, so many of us pride ourselves on a strong work ethic, right? When we feel a sudden twinge in our lower back, or our neck tightens up, or joint pain makes lifting or typing a total nightmare, our first instinct is usually just to pop some ibuprofen, grit our teeth, and pray it fades by the weekend. But here's the thing, if you've got ongoing pain, stiffness, or trouble doing your everyday tasks, that is a giant, flashing red flag from your body. It needs professional attention, not just a tough-it-out attitude.
I want you to take away this one crucial fact right out of the gate. Your pain is incredibly valid. Whether it was a dramatic, obvious accident that everyone in the room saw, or a slow-building ache that just finally became unbearable, delaying your care can make the physical injury so much worse. And just as importantly, holding off on getting checked out can seriously complicate your ability to file a valid workers' comp claim down the line. Ignoring it is basically putting both your health and your livelihood at risk.
And here is something a lot of people don't realize. You can be legitimately hurt at work without a single chaotic accident. We always picture these sudden events, right? A slip, a bad fall, lifting a heavy box and feeling that awful pop. But a gradual buildup is just as dangerous, if not more so, because it sneaks up on you. We're talking about repetitive strain from poor ergonomics, hours of bad posture, or doing the exact same micro-movements thousands of times a week. Both of these scenarios cause real, lasting damage, like chronic low back pain, wrist issues, or severe tension headaches. And both of them absolutely count as highly legitimate workplace injuries.
Unfortunately, because there's so much confusion around what actually counts as an injury, people make a lot of errors early on. These are the three most common mistakes we see. Number 1, not reporting the incident right away. Number 2, playing the waiting game, hoping the pain will just magically disappear. And number 3, returning to full duty way too quickly without making a single change to how they work. Honestly, failing to report an injury early makes it incredibly difficult later on to prove that your pain is actually connected to your job, and that can delay or even completely deny the crucial treatment you desperately need.
Now, what if there was a specific incident, but you felt totally fine in the moment? Look, adrenaline is a wildly powerful thing. Pain from a job injury, like whiplash, a back strain, or a joint issue, can absolutely show up hours or even days later. It still counts. Do not write it off as just sleeping funny. You need to report the incident immediately and get a professional evaluation the second you notice those symptoms. Having good, solid notes from the very start helps connect that delayed pain directly back to the work event.
Okay, so let's build your clear action plan, your roadmap to recovery. If you are injured, you need to follow these 3 non-negotiable steps. Step 1, report it to your supervisor or HR as soon as you safely can. Yes, even if it feels minor. This creates your official timeline. Step 2, get a medical assessment. Seeing a chiropractor who handles job injuries means they can check your spine, test your range of motion, and most importantly, rule out any life-threatening emergencies. And then step 3, establish a clear treatment plan. This might include temporary work restrictions so your body actually has the time it needs to heal properly.
And the crucial point here is the why behind those steps. As this quote nails perfectly, good documentation and early care reduce a massive amount of stress later on if your symptoms worsen or your case gets reviewed. Early care calms the inflammation and restores your joint function fast, while that early paperwork protects your legal rights. It basically takes the anxiety completely out of the equation so you can just focus entirely on getting better.
Section 1, the treatment ecosystem, how chiropractic care and physical therapy work together.
There's this weird misconception out there that these two disciplines compete with each other. But actually, they coordinate beautifully. As you can see, chiropractic care emphasizes your spinal alignment, joint movement, nerve function, and gets you that immediate pain relief. Meanwhile, workers' compensation physical therapy focuses heavily on muscular strength, flexibility, and actually simulating your specific work movements. When you combine them, this team approach improves your pain, your mobility, and ultimately gives you the confidence to return to your normal duties without getting any mixed messages.
Together, this creates true work injury rehabilitation. And guys, this isn't just a quick 10-minute massage. It is a highly detailed, comprehensive plan. It kicks off with a deep dive into your medical history and a full physical exam, sometimes bringing in x-rays or scans to catch any hidden underlying problems early on. From there, you move into active treatment, targeted spinal adjustments, soft tissue work, stretching, and strengthening. But maybe the most important part? It includes ergonomic advice tailored specifically to your exact job, ensuring you don't just feel better today, but you stay safe tomorrow.
Now, I know exactly what many of you are thinking, so let's just address the elephant in the room. Am I going to have to stop working entirely while I get this treatment? Thankfully, the answer is usually no. This is a huge source of financial anxiety for people, but chiropractors can very often suggest modified duties, things like lifting a little less weight, taking more frequent micro breaks, or maybe working shorter shifts. This setup allows you to stay engaged and keep earning a paycheck while you recover safely, completely avoiding those long, isolating periods stuck at home away from work.
Let's look at a real-life timeline to see exactly how this recovery roadmap looks in action. Imagine someone working at a call center. For months, they've been dealing with poor posture and long, grueling hours stuck at a desk. Eventually, by the end of every single shift, they're getting this sharp neck pain and just blinding headaches. Finally, they speak up and report it. On day one of their care, they visit a clinic like Core Chiro Rehab. The provider adjusts their stiff joints, releases those tight knotted muscles, and actually teaches them how to adjust their chair and monitor height properly. Just a few weeks later, they're back at work with better posture, way fewer headaches, and vastly reduced pain. It is literally a complete turnaround.
Section 2. Finding the right care. Searching for work injury treatment near me.
Once you've ruled out any major life-threatening emergencies, finding the right specialized provider is key. If you hop online and search for a workers' comp chiropractor near me, here's exactly what you need to be looking for. Obviously, they must be a fully licensed professional, but beyond that, they need very specific experience with workplace injuries. They absolutely must understand the complex web of documentation and insurance requirements because that paperwork is no joke. And they need to be able to communicate crystal clearly with your employer and your case manager. Choosing someone with this specific skill set cuts down on delays, prevents any messy confusion over your work restrictions, and keeps the entire team focused on one single goal, getting you fully recovered.
Section 3. The Core Chiro Rehab Difference. Your partner in healing and documentation.
Their philosophy at Core Chiro Rehab is simple, but it is incredibly effective. As they put it, combining precise hands-on care, clear work restrictions, and easy-to-follow home exercises gives workers the best chance of returning to their duties with confidence. They totally get that treating a work injury is a two-part process. Yes, you absolutely need expert, hands-on care to fix the muscles and joints, but you also need smart, realistic workplace ergonomics and actionable home exercises. That way, once you're healed, your risk of getting hurt all over again is significantly lowered. It really is all about building that long-term resilience.
Which leaves us with one final, very important question for you to consider today. Are you ready to finally stop pushing through the pain and actually start your recovery? Remember, pretending a workplace injury isn't there won't make it go away. It only makes the physical damage worse and the claims process a whole lot harder. Your pain is valid. Please, don't wait until you physically can't do your job at all. Take action today, report your injury, and reach out to a specialist who can guide your healing journey. Thank you so much for joining me for this explainer. And hey, here's to a safer, healthier workday.